Hi, Dr. Crenshaw and class. My name is Jasmine Ayano, and my topic for discussion in this PowerPoint is codependency. So codependency is a learned behavior that can be passed down from one generation to another. It is an emotional and behavioral condition that affects an individual's ability to have a healthy, mutually satisfying relationship. And it is also known as relationship addiction, because people with codependency often form or maintain relationships that are one-sided, emotionally destructive, or abusive. And codependents often experience brain changes just as do other addicts, such as alcoholics. So the biopsychosocial symptoms in regards to codependency, biological factors include abnormal neurotransmitter functioning and genetic predisposition. Psychological factors include expectancies toward abusive behavior, a sensitivity to environmental cues for drug abuse or alcohol, poor self-esteem, and peer influences. And social factors include a dysfunctional family system and community-based expectations. And some of the factors that shape the brain, thoughts, and behaviors, there is a long list, so I'll just go ahead and talk about a few. One of them is a lack of trust in self and/or others, allowing them to create a codependent relationship because they don't trust themselves with anybody else, or that they build a rapport with one boyfriend or girlfriend and they trust that their boundaries cannot exceed those limits. Another one is problems with intimacy and boundaries. I think that plays very well with what I just said in lack of trust in self and others. And some also include poor communications, lying or dishonesty, difficulty in making decisions, and a sense of guilt when asserting themselves. So low levels of assertion, and a compelling need to control others. So again, there's quite a list on the PowerPoint that I have also provided for you. And some evidence-based interventions. When it comes to codependency, it's almost usually always rooted in a person's childhood. Treatment often involves exploration into early childhood issues and their relationship to current destructive behavior patterns. So their treatment includes education, experiential groups, and individual and group therapy, through which codependents rediscover themselves and identify self-defeating behavior patterns. And treatment also focuses on helping patients getting in touch with feelings that they may have been buried during childhood and on reconstructing family dynamics. And at the end, the goal is to allow them to experience their full range of feelings once again. So with social work, and as a social worker, it's very important that we practice worldview respect and be culturally competent while working with different populations, since codependency hits almost every population that we have around us. And one idea is having codependency support groups will definitely focus on identifying strengths of each member that will help them in their empowering progress, knowing that they're not alone in this problem that they're facing. And supporting those who face codependency will definitely empower them to take charge of their lives, both inside and outside of their therapy, of their group therapy, of their activities. So I did include two quotes from two different authors on the PowerPoint, and one I like is from Dr. Fredrickson, and she says that just as there is a series of chemical reactions taking place in the brain of an alcoholic or an abusive drinker, so too there is a compulsive-like process occurring in the codependent's brain. Instead of that process involving dopamine and the pleasure-reward communication networks, as in the alcohol's brain's limbic system, the codependent's brain taps into adrenaline, and also among other hormones and neurotransmitter, and the fight or flight communication networks, which also originate in the brain's limbic system. And in regards to race, gender, sexual orientation, and spirituality, codependency definitely affects all parties throughout the populations that we work with. And the willingness to be self-reflective, I see it as codependents definitely have low self-esteem and they look for anything outside of themselves to make them feel better. So I think that they find it hard to be themselves. Some try to feel better through alcohol, drugs, or nicotine and become addicted. Others may develop compulsive behaviors like workaholism, gambling, or indiscriminate sexual activity, leading to a sex addiction. They also have good intentions. They try to take care of a person who is experiencing difficulty, but the caretaking almost always becomes compulsive and defeating of themselves. So codependents often take a martyr's role and become benefactors to an individual who is in need. So a wife or girlfriend may cover for her alcoholic husband or boyfriend. A mother may make excuses for a truant child, or a father may pull some strings to keep his child from suffering the consequences of delinquent behaviors. And finally, I chose codependency because it affects everyone. It can affect a spouse, a partner, a parent, sibling, friend, coworker. And originally, codependent was a term to use to describe partners in chemical dependencies, persons living with or in a relationship with an addicted person. And similar patterns have been seen in people in relationships with chronically or mentally ill individuals. So today, however, the term has brought in to describe any codependent person from any dysfunctional family. So to end again, codependency affects all parties, all populations that we will eventually work with. And I think just addressing some key terms and some key issues can definitely be beneficial throughout our field of our MSW program and when we become MSWs. Thank you so much.